Hello, everybody. My name is Travis Dye, and I'm from Daniels, West Virginia, which is a suburb of Beckley. I have four dogs, and hobbies include going out to the lake, spending the day on the water. I have a boat and a jet ski. I like to go out on my four wheeler and side by side and take the dogs on long walks. They like chasing the side by side. I like to work on cars and small engines and do DIY repair. I also like to travel. I've been on several cruises and had the opportunity to explore pretty much most of the Caribbean islands. Also, since I was a teenager, I've officiated youth sports, and currently I've done all the way up to college level. So I enjoy doing that in what little free time that I have. I attended WVU School of Nursing. I got out of WVU and I accepted a job. I worked in the operating room as an RN. I left there to pursue a job with state funded programming. I'm dealing with assessing elderly population, writing care plans, advocating for them, communicating with them, training and placing caregivers in order to make their quality of life better so that they could stay at home, get a little support from an RN, do some at home visits, and keep them out of a nursing home and keep them safe. Reasons for wanting to pursue an MSN Family Nurse Practitioner degree is I enjoy completing tasks that the end result is helping people. And to me, it gives something back to the community. It makes it a better place. And I want to do this through, clinical practice as well as teaching future RNs through college level someday, my skill sets and the career skill sets so they can carry on the tradition and the compassion for doing so. Also, I've had the opportunity to have personal experiences before I was an RN, and again after I'm been an RN with individuals in the healthcare setting that are fantastic. They're dedicated, they're passionate, they put their all into it every day. They want to listen and help. And then I've also seen people that are in it for the wrong reasons. So these are a couple of the reasons that I want to pursue this career path. My vision for nursing practice is to be able to revert back to a time when we can spend more time sitting and actually talking and actively listening to patients. And we want to develop those good rapport in order to better serve and meet their needs. And I think in return, this would make them more compliant with medications and the requests that we would put on them. And I believe that we got to follow patient centered medicine practice because I feel it's being lost in the hectic pace that we're in. And we need to do our best as a cohort in today's world to help salvage that. And I think helping to educate patients is something that will improve patient outcomes and improve quality of life. But in my experience, it's usually the thing that's left off in today's healthcare. So we need to get back to doing that because that could be the event that makes the difference in life altering situation in someone's life that they may lose out on. A couple goals that I have for this class is one to learn the fundamentals of the advanced practice role, instill some of these concepts that will be able to work into my own practice as a family nurse practitioner. A couple barriers. I think the practice is always changing, and time constraints have made some of these concepts not possible in today's healthcare setting. And also, no matter how cool or beneficial something appears on the surface or in writing, um, to us as medical professionals, it's not always going to be universally able to use as a fix-all approach for patients and especially in different settings. The other goal that I have is to develop strategies how to better serve these patients for both health promotion and disease prevention. I think that's going to be in family practice the biggest things that we can do to help our patients is prevent them from going to the hospitals, notate those risks, and help come up with plans and how to better serve them and meet their needs. In general, I feel that learning some of the material. On the other hand, though, it can be dry when you're learning it, not motivating. So I'm going to try and be positive and try to apply it to real world situations, and that will help me make it make better sense. So, in summary, I'll just end by saying that even though we live in a complex society, and we're going in every direction. Life brings us change, takes us many different directions, and you have to kind of roll with it. You have to make sound decisions every day. You have to take the time to make these decisions in the best interest of our individuals involved, and also see it in a positive manner, regardless of the situation or the person or how they're treating you or what the case might be. And I think this is the approach to take, not only in your personal lives but also when dealing with patients on a daily basis. So I look forward to reading your comments and getting to know you guys better. And I hope we have a great class. Looking forward to it. Take care.